We're live and we're
live at 5:34.
There we go.
Welcome to the Unplugged Health.
I've even forgotten
podcast.
what we just agreed that we're
Show
going to talk
number
about.
1.
One of the year.
We've been going
It is the
since
first one, yeah, hey?
It is the first one of the year. We've been going since 2019. In fact,
Oh,
I
right.
popped up the episode in January 2020.
Yeah, I think I looked at the YouTube thing and suddenly went, because that was in the old practice and time's
The
ticking on.
podcast, which was January 2020, and we were talking about this thing beginning with C, and would it be very big? And both of us said no.
Yeah.
We were quite wrong. Let's hold our hands up. Well, anyway, let's move on from that.
Well,
Before we say
unfortunately
something
we are moving on
Yeah.
from that.
Thankfully, yes.
So what did we agree? Our topic?
Our views on what is the number one thing
Yeah.
to focus on. Was it marker to improve your health or thing to focus on?
It was the number one factor which determines your overall health and longevity.
Okay.
That's what I read the other day, and I thought that would be an interesting discussion.
Did
So
you
I
read VO2 max?
no.
What did you read?
What
What
did
did you
I
read first rather than an opinion?
What
You
did
said
I
you-
read?
You said you read it.
It was like I think it was even in another podcast, or it was a headline or something.
Yeah.
I didn't read any article. I just remember reading that and going, "Oh, that's interesting." But I wonder what that might be a good headline or starting point for one of our discussions. And I posed that question then also for our viewers and followers of what do they think because we all know there's not going to be one thing. Health is a combination of many factors, but
Exactly.
what is the number one factor or the top 5 or whatever it is of what you want to look at of the factors that determine not only overall health but longevity as well, because there's interesting studies certainly with the elderly which will highlight the top 10 if I remember correctly, they did a survey or a consultation of the top 10 factors that determine the life expectancy, but the health predictions of the elderly.
Mm-hmm.
The top one was loneliness.
Yeah.
So they had smoking, they had all these other lifestyle factors, diet, exercise, past medical history, all these things. But loneliness was actually the number one thing, which highlights that in the elderly, that connection and the social side on how that can impact hugely. And that's one of the biggest predictors in the elderly of how socially active and their social connections of how important that is.
It's not just mental, it's also physically exposing yourself to bacteria as well.
Yeah.
You don't have that social exposure and then suddenly you go out and expose yourself to that bacteria, you get sick.
Yeah.
Which is what we saw a lot after pandemic, right? Because people weren't exposed to stuff and they went out and there's a lot of sickness.
And in the UK, we're coming a little bit towards, well, the optimists are saying towards spring, but we're still probably in winter. But this winter, there's been a lot of cough, colds, flu bugs going around, and which is kind of taken over a bit of the concept of just that it's all about COVID and that. Although that's still a factor, but it's been quite interesting of the exposure to a lot more social interaction, a lot more international travel now, and people also, a lot more aware of the knock-on effects of exposure to other things.
Mm-hmm.
But then again, not everyone gets ill, so there's also the factor of exposure. It's the old same thing, exposure as well as what is our immune system like at the time. What we find within our profession, because we see lots of people for short spaces of time all day, we tend to always feel that our immune systems are being triggered and exposed by small doses, like the old thing of kids at some place. Is there a place for them to actually have dirty hands and eat a bit of soil and dust rather than being in a totally sterile
I eat
environment?
soil all the time.
Yeah.
I don't get sick.
Yeah. Hang out in sand pits.
Can you track that in MyFitnessPal?
Yeah.
And for
Put it down as an activity.
Yeah.
Garmin.
So
What did you do?
that?
Ate soil.
Yeah.
So factors that you've always, and we've spoken a lot, and go back to some of our past podcasts on sleep. I mean, that is going to be a big one because it is reflective of how we run our lives with sleep, and also the impact that on so many systems. So sleep, I think, is right up there with one of the big things.
Sleep. When we talk about carcinogens and like the carcinogenic impact on health.
Yeah.
Why do I struggle to say that word? But people say that increases your chance of getting cancer, and this is where the aspartame debate comes in. And I was doing a thing where the post I'm going to put out, which is like things that are more deadly than aspartame that we know, because in carcinogens, 2B carcinogens do not have to be tested on humans. They only have to be shown trials in mice, and that's where aspartame has been put by the World Health Organization. Or 2A is being a hairdresser or barber, but higher up than that, level one, first off, like well done meat and processed meats and things like that, things you would expect, although sunlight is up there, and also getting 6 hours or less sleep and broken sleep. That is more carcinogenic than aspartame. Alcohol things up there as well, like sun.
But also we've spoken before and identified that you've got that element also, you've got a genetic element, so you might have a loaded gun, but then you've got to pull the trigger, and modern day lifestyle really is a lot of the time pulling the trigger. There was a very good interview from a guy on radio the other day who was a cancer specialist, and they were then saying, why haven't they got a vaccine? Why haven't they solved cancer? And he said, it's such a complicated topic. There's so many different cancers that some are directly viral, but most of them, it's the immune system's response to triggers, of which some people, those triggers will have no harm. We all know about someone who gets his lung cancer but has never smoked. It's not the only factor, and as you say, then you get things like sleep.
There's some recent studies actually on lactobacillus, being the probiotic bacteria, that it can reduce high levels of estrogen, which is what they give to women, they give tamoxifen to women after they've had breast cancer to make sure they don't have that high level of estrogen again, to reduce the risk. What that tamoxifen does is increase lactobacillus. So there's studies that show they can have the same effect without the liver toxicity of the tamoxifen. This is not to say like go and change this if you're doing it. This is just research that I've seen and read, is that when they give lactobacillus as a bacteria, increasing that lowers the estrogen to the same, if not better, than the tamoxifen.
But and then you have therefore the deduction of how important gut health is.
I think
from a digestive thing. So we got sleep, and then we got gut health.
Yeah,
is some of the two main big factors at the moment.
What came first, the chicken or the egg? Is your sleep impacted by your poor gut health because your glucose management is all over the show?
Yeah.
Is it the stress level from your brain, but then is your brain, because it's not getting 90% of the signals are sent from your gut to your brain rather than your brain to your gut.
But isn't it, that's the whole point of more functional approach to healthcare, is then looking at saying there isn't one thing, but when you mention something, so someone talks about diet and then you talk along those, you really open up a can of worms, because it's not your discussion when you're dealing with a client is not then about sleep. Mm-hmm. It's because it leads to other questions. So someone says, well, sleep's okay, I'll sleep fine. And how many hours? Well, I sleep, I can survive quite easily 6 hours. It's almost provided. And it's like, well, we're not talking about whether you can survive on sleep. It's what does regular good amount of sleep do on the system. That then opens up another discussion on stress management, which then opens a discussion of eating food on the run, which means then life balance and job, and so it's not.
This is why we have to test.
Well,
you do a full blood test, and you can see where the liver function. I see where white blood cells, oxygen levels, like red blood cells. We test, but then you can test for cortisol and things like a cortisol awakening response. Yes, they're only based on that day, but if we see that someone has a high cortisol in the morning, which is good, like that raise, and then low. I had one back from a client the other day, and it was just there was no kickstart with the cortisol.
Yeah.
We need that to wake us up. So we need to work on her adrenals. And I see it more and more in women as well, doing these tests. I'm seeing low testosterone jump up so much in women. So there's low drive, low
never
sex drive.
it's never
low
given
motivation.
much of a focus. It's
No,
you know,
it's-
women's hormones is all estrogen.
But how many
progesterone.
times you've probably had people say, if you've spoken about testosterone in women, people say, I didn't realise women had testosterone.
Yeah.
Just
So
like
that's what I'm
guys
saying.
having
It doesn't
estrogen.
cover any. Doesn't get any coverage.
And that it's not even tested a lot of the times in female hormone tests, which frustrates me because it's really important.
Yeah.
When you see women not able to lose weight, yes, people say high testosterone, you look at PCOS, but you need good levels of testosterone, good levels of estrogen, to be able to function, and progesterone as well. Like you need these functions, but then what happens a lot of the times is sex hormones are produced from cholesterol to pregnenolone and so on. So actually, people following low-fat diets, not getting the raw materials. So what we find with a lot of women, I'm working with more women perimenopause and now hit the menopause and post-menopause. So in their 40s and 50s, that was the generation around my age or slightly older that were always following those low-fat diets.
Yeah, and then also you've got that stereotypical protocol within the medical system of certain markers, cholesterol levels, you're automatically onto medication.
Yep. But
which-
why is it
to bring
high
to
cholesterol?
draw them down? Well, also there's a debate of what is high and you know, there's a whole lot of can of worms, and when you force one system, a hormonal system, force it down, still doesn't mean that the body's still not trying to push it up. And so again, we go back to what we discussed of why would that be, and how do we influence that?
Like we see high HDL, which is supposed to be good cholesterol, and I see doctors saying that's fine, a little bit high. But why is it high? And this is a sign of leaky gut and gut dysbiosis, that the body's increased it to fight that and to try and improve it. So we get back to the gut again. Why is it high? Gut
So
health.
sleep, gut health.
I'd say gut health, sleep.
Well, yeah, and we know that they interact together. And if you have to be really holistic, you'll go gut health, sleep, and then you've got thoughts and functions. So you've got mental health. Because if you then
But
got
if your gut health is throwing your glucose off and your glucose goes down and pushes your cortisol, then that's going to inherently make someone, pretty certainly make them anxious. But if someone's already anxious, it's going to make them more anxious.
So we'd also
the
then
gut
go
health.
from more of the chiropractic side of us would be the nervous system, and therefore you've got physical, emotional, chemical. So chemical, gut health, emotional, sleep, element, and stress, and then physical would be movement, because the nervous system thrives on movement. So you need
Regulate.
stimulation and correct stimulation. So toxicity or overload stimulation on the nervous system would be like going back to sleep, your blue lights, and then your stress go, you know, flight or flight versus your rest and recharge. So the physical element for us also would be longevity, would be some level of movement. It doesn't mean that you're having to go into the gym and work out, but we live in a culture where everything has become very passive, so it's easy to sit and be entertained rather than movement. So movement stimulates movement through the joints,
And not too much
fires up
movement.
receptors, fires up the brain. The brain thrives on stimulation through the body. So for us, some level of movement is important from
But
that.
not in your sleep.
Well, no, you should
Get
be. You
punched
should be.
by your wife or something.
You should
Something
be.
a few times.
You should be in really your deep sleep. You should be kind of paralyzed.
Well,
Technically.
yeah, it sounds horrible, but that's what your body does, right?
It is.
So we don't.
It is.
But there are people there was someone that I've heard of that got away with murder because he had a condition that meant his brain didn't paralyze himself during sleep.
Yeah.
So he killed his wife during sleep. Don't know how they proved it.
Hopefully
in
not
court, but-
intentionally.
Well, apparently not. So
But yeah,
don't give people ideas.
you don't move enough, not eating well, and negative thoughts and stress hormones, and then gut health. They all interact.
Yeah, and for negative thoughts, chances are dopamine, serotonin. So we're going to crave that. So we'll eat worse.
So going back to our
I
question,
don't know which one was 1, 2, 3. They were all like
they're not more important than the other at the end of the day, because they also are indicative. If you test and find one thing out, I'm sure you found this, that doesn't mean that's the problem. That's the medical approach generally, is we've tested that and that this this hormone or this is low, so what we'll need to do is get it up.
Yeah.
Or your blood pressure is high, so we need to bring that down. Rather
This is where we
than
look at
why is it
systems,
high and what we're going to. So each system interacts. So it's the difference between breaking the body into body parts or identifying that the body works with all parts and more together. So I think we've got 4 so far. So we go for 5: movement, sleep, gut health, and then mental health, positive thoughts, being proactive. Anyone else? And another one?
Your environment.
So
toxins in your environment, mold and everything. Yes, mental health and community, but mold, BPA exposure with loads of like smelly chemicals and plastics you're drinking out of. I would say that's so underrated. The
it's becoming
putting on your skin, your skin's an organ.
I think there's a lot more people out there. I don't know if you've noticed, a lot more people with. You're probably preaching to the converted of those who are drinking more water. They're a lot more aware of plastics or reusable plastics as a BPA safe, or using glass or stainless steel containers. Especially things that get heated up, sit in the car in summer.
Plastic bottles in the car,
these kind of things of sitting. So there's a lot more exposure. I think there's more and more awareness to some degree of cosmetics. Being an environment is huge. Okay.
That's 5.
There we go. That's
I'd love
5.
to know if other people agree, disagree.
Yeah.
What are your top?
Are there things that we've missed out which you feel is valid to knock one of those off, or an expansion of that? It would be interesting to know from you what are some of the factors that you think is important which increase our likelihood of having better overall health, wellness, and then longevity, because they go hand in hand. We all really want, we don't live forever, but we want to live long and healthy, and then we stop rather than a long but unhealthy life. Right, thanks for your time, guys. We'll catch you soon, and thanks, Ollie, and we'll see you soon.